My name is Kathleen Walsh. I'm a family medicine resident at Locuming University. Today, I would like to share with you my research project on the experiences of new physician graduates transitioning to rural practice in Ontario. Our research team consists of Cara Passy, Dr. Carrie Reed, Dr. Nicholas Shaw, and Dr. Sarah Newberry. This project received funding from the Northern Ontario Academic Medicine Association. Let's get started. Today, we will review what led to this project, how we carried it out, some key results, and recommendations directed at the physician recruiters. We know recruiting and retaining physicians in rural Canada is challenging. New family medicine graduates appear a promising group to recruit, as they may not have yet laid roots and still have a broad knowledge base from residency, which is useful for rural generalist practice. However, we know from the Rural Northern Physician Group Agreement, very few new graduates enter practice in these rural communities. The period of transition to rural practice is also not well explored in the literature. However, we wonder if this period of transition could provide clues as to how to recruit and retain physicians. The goal of our study was to understand challenges and successes of early year physicians as they transition to practice in rural areas. For our methods, we did a qualitative study using hermeneutic phenomenology. This approach focuses on the lived experiences of study participants. We recruited 20 early year family physicians who met the following requirements. 1, they graduated from a Canadian family medicine residency program within the past 5 years. And 2, they practiced for a minimum of 1 year in rural Ontario. Participants did a demographic survey followed by a virtual semi-structured interview. Interviews were transcribed and then coded by 2 team members. The same members reviewed the codes and through an iterative process created themes which we supported with quotes. Themes and transcripts were reviewed by an independent researcher and themes were shared with participants. 2 participants ended up being excluded as one recording was lost and one did not meet criteria. Who did we end up interviewing? Our group had about 55% identify as females, 40% male, and 1 person identified as non-binary. Most were 30 to 40 years old at the time of the interview. In terms of educational experiences, most of the time in a rural community as a learner, and most attended medical school in Ontario. A variety of residency programs were represented, with the biggest representation from the Locuming University and the University of Toronto. In their first year of practice, most participants held more than 1 role. All worked in primary care, and over 3/4 worked in the hospital and the emergency department. So what did we find out? As you can see here, we ended up with 8 themes and then 18 sub-themes. We don't have time to share them all with you today, so we will review 5 sub-themes relevant to physician recruiters. The main themes are listed here. The first sub-theme we wanted to share is the influence of practice incentives. This is under the theme of choosing rural practice. A majority of the participants we interviewed received some sort of incentives to practice in rural communities. Physicians felt it was important to be appropriately compensated. However, incentives were not the primary driving force to attract or retain them to a rural community. As one participant said, "It's nice to know that I can get a chunk of money when I set up my own practice here, but if that weren't the case, I would still do it." Our next theme is navigating work-life balance, and there's 2 sub-themes we would like to share. The first one is distance to friends and family. Many of our participants relocated to a rural community to practice. They indicated that distance from their family and friends was a major challenge. Physicians expressed feelings of isolation, felt they were missing out on experiences with friends and family, and noted both the financial and time burden of having to travel great distances to visit them. These challenges amounted to some physicians leaving their rural communities to relocate closer to their families. As one participant said, It's unfortunate because I think it's just one of the biggest burdens with rural communities retaining people is keeping them away from their friends and family for so long. It's a hard sell. Our next sub-theme under navigating work-life balance was the importance of being integrated into the broader community. Our participants said it was important they felt connected to the community which they practiced. They valued having friends outside of work, being invited to social and community events, and having community members care for them in capacities outside their roles as physicians. Lack of integration led to feelings of isolation and sometimes contributed to leaving a community. Members of the healthcare team, including physician recruiters, sometimes played an instrumental role in bridging this gap. One participant provided this advice to new graduates. Try and be part of the community, because the more you get, the more you can make it feel like home. If it's somewhere that's far from home, then the less likely you are to be homesick, the more likely you are to enjoy your life outside your job. Our next theme is challenges during transition to practice, and the sub-theme is navigating generational changes in practice styles and community expectations. The physicians we interviewed described various challenges if they were taking over an established practice. For example, some had difficulty transitioning a practice from paper charts into electronic medical records. There were some differences in prescribing practices from predecessors, and some had challenges with matching the volume of patients of predecessors. Communities and clinics also had certain expectations of new graduates, which at times led to conflict. For example, sometimes new physician graduates were scheduled the same as older physicians, but struggled to meet the demands placed upon them. One participant provided this quote: "The 3 physicians who retired here had a cumulative number of patients exceeding almost 4,000 patients. I don't know of any new doctor who's ready to take on 1,500 patients. So, if communities think they're going to replace 3 retired doctors with 3 new doctors, they've lost their minds." Our final theme was locuming, and the sub-theme was the value of locuming. For those of you unfamiliar, a locum is a physician who does work for another doctor who, for example, may be ill, on maternity leave, or on holidays. 8 of the physicians we interviewed locumed in their first year of practice. Both those who locumed and those who did not locum reflected on the value of locuming in their early careers. Some of the benefits noted were it allowed physicians to explore different practice styles, physician teams, and community setups. One participant provided this advice to new grads: "I would locum first, locum for years first, and locum in lots of different places. Tying yourself down in your first year of practice is not a great idea. I think it's important to play the field and see how things run because you have so much more knowledge about how you want things to run and what works for you." We will end by sharing 5 recommendations which we have made based on our interpretation of these sub-themes. First, we recommend considering non-financial incentives. For example, consider non-financial logistical supports such as housing, childcare, and roles for spouses. 2, given many physicians will live far away from their families, consider offering extended vacation periods and funding for travel. 3, since we know it was important for early year physicians to feel connected to their communities, help them feel connected by notifying and inviting them to social and community events. 4, physician recruiters can play a huge role in helping communities manage expectations for a new graduate, both in how they want to practice and the size of the practice they wish to take over. And 5, since we know many early year physicians start as locums, encourage learners and new graduates to locum in your community. You could also consider recruiting locums for full-time positions. Thank you for listening to our presentation. Please watch for our upcoming paper for a list of all of our themes and recommendations, and we're happy to answer your questions at this time.